Hi, this is Dr. George Rogu from RBK Pediatrics Urgent Care in Comac and in Bayshore. Well, the COVID-19 virus challenge. RBK was put up to the COVID challenge, and we thought we'd tell you what we did to help the community in 2021. So I want to give you a little overview of the pandemic, how it started and what was done, and then move forward into 2021 and tell you what we did. Now, the overview of the pandemic. Everybody knows March 2020, coronavirus was declared a global pandemic. Immediately, businesses closed all over the place. Schools were closed. The supplies for the protective gear was scarce. RBK was faced with the challenge of what is it that we're going to do? Are we going to close? We've never closed, not even a single day, during our entire 58-year presence over at 646 Comac Road. How can we close now? Many offices indeed did close, and patients were sent to the emergency room. This was a huge challenge because basically we've never even shut down operations completely. We were always there at least for an hour or two. Even during Hurricane Sandy, we watched and examined patients at sunlight, by the window. We went back to paper. But I'd like to tell you what are some of the changes that we did implement to our staff in the office to keep our staff and our patients safe. A very important thing that you must remember is RBK was always there for you. We never shut down. So that's the most important part of the challenge. So changes that we made to the workflow were pretty simple. Keeps well patients on one side, keep sick patients on the other side. Implement telemedicine services like everybody did. We had telemedicine even before COVID for simple medication renewals. But an important thing was to keep the doctors and the staff in the building seeing patients, even though there weren't too many of them. Now, the telemedicine services that we did was with Anytime Pediatrics. We used it in the past for medication renewals. But this helped position our physicians to offer this service when we needed to use it for acute care illnesses, for the hybrid well visits that we did at one point when people were not able to come into the office because of the psychology behind that, oh my God, it's a medical facility, I don't want to be exposed. And we also use it for the COVID antibody test in the parking lot. As time passed on, people were still afraid to come to the office because of the exposure. And that's when we did the outdoor tents for well visits, try to get people back in and make them feel as comfortable as possible. We started to perform part of the well visit through the telemedicine while the patient was in the parking lot. And then everything was said and done. We wrote up everything. We ordered all the vaccines. We did all our discussions, referrals, med renewals, and so forth. Then we would invite the patient to come up to the tent, which was located on the grass in front of the Comac Road office. And we would examine them, give them their shots, and off they went. Very little contact. As the fall and the winter months came around, it became a little bit difficult to use that tent. So we had to develop another MASH catwalk tent, I called it. And that was used to see all the potential COVID cases on the side of the building at the 646 building. And that's when we started to implement the COVID testing program, where we did PCR and rapid COVID testing in the office. This helped to get children back into school faster because the rapid test was very good to determine whether you're contagious or not at that moment in time. So, for the kids that got kicked out of school and they had absolutely no symptoms or had minimal symptoms of anything and COVID test was negative, we were able to get these kids back into school faster than if you sent the PCR to the lab. I mean, the PCR was a great test, but it was painful to the children because they had to basically do a brain biopsy, stick the swab all the way in the back of the nose, and the kids cried and it hurt. And it took a couple of days to get back. As the winter months came, however, it became more and more difficult to see these patients because there were many more sick people to begin with. Kids were sent home from school because they needed clearance and testing. We had many children that were delayed in the well care visits, many children that were delayed in the vaccinations. And we tried to manage the patient flows and the patient's expectations to the best of our abilities. It was difficult at some times. But if you remember, at least we got patients in and out in a reasonable amount of time. If you looked at any of the urgent care centers like City MD and so forth, the hours, the people were waiting for hours on these long lines. You can remember seeing them on the street. Now, I'll talk to you a little bit about the hybrid well visits in a medical tent. They were a little bit apprehensive to come in at first. They were behind in the vaccines, but they felt comfortable coming to the parking lot, sitting in their car, talking to us through telemedicine, and then coming up to meet the doctor for the examination. At the bottom, you can see the doctors and some of the staff. And this is a little bit of scenery from when we did the medical tent down at the bottom of the parking lot, where we did the initial intake through telemedicine for the screening televisit, and then we would, basically get scheduled patients. They'll drive down to the bottom of the parking lot, and over there somebody would go and take the blood. It helped to alleviate, the blood tests were pretty good because it helped to alleviate a lot of the stress that the families have. Did my child have COVID and I didn't know? And indeed, a lot of the children were indeed positive. And it was a great sense of pride for a lot of our patients and for our staff. They thought that they did something good. Here's some pictures of the medical mass unit where we put up some partitions on that catwalk, and we used it in the fall to help, use it as a sick room to help segregate the well and the sick. If there was a suspicion of COVID, we would see them outdoors. We wouldn't bring them into the building. We used it for the testing to get the kids back to school, to get the kids tested for going back to college. But as it, became colder and colder, and if it rained, it became even more difficult to use. In the Bayshore office, the waiting room was a little bit bigger, so we were able to put these tents inside the waiting room, and we used those tents for basically more clinical space. We tried to use it initially for, for testing, COVID testing, or we used it for during the COVID vaccine clinics. The nurses would station themselves in there, give the vaccines, and then send the patient into the examination rooms to wait there 15 minutes. And as we moved our 375 office, which you'll hear about a little bit later, we used it as more examination space during the transition build-out. Now, everybody knows everywhere, especially in medicine, this COVID was a potential for an economic disaster. But happy to report that RBK Pediatrics, we survived, and we got even stronger. And I think that's because we were there for people, and people will come to us because of loyalty. The time period 2020, 21 was really difficult because there was a dramatic decrease in the amount of office visits that we had. Thank God for telemedicine, because we were able to supplement some visits with that. We also had problems because a lot of the staff, including myself, we were infected with the COVID-19 illness. Thank God nobody was really all that sick. But there have been a lot of cases that I know of that the patient was really sick. We unfortunately, like everybody, had to furlough some staff, but we rotated it. So we never really hurt any one particular person. RBK applied for the government funding like everybody else did to keep us going. And I'm proud to say that we did not let any of our staff go because of COVID and just blame it on COVID. A lot of hospitals, a lot of larger organizations will see a decrease in the amount of visits. So they figured the way to cut corners is to get rid of physicians, get rid of nurses, and so forth. Now, another project that we are very proud of is the COVID vaccine clinics. RBK Pediatrics was the lead practice on Long Island to have the COVID vaccine in office when it was available to offices. It took a while for the state to approve it, but when they did, we were there. We were the first ones to get it. The protocol for the administrations of the vaccine was very complicated, but we already had the infrastructure on our computers to upload it to the New York State Registry, so it wasn't all that complicated. We did connect with, this technology company, Canid, which helped with scheduling the appointments for the COVID vaccines. So we didn't have that, crazy, large amounts of people, or people can't get appointments. We always had appointments. And ever since we started in May, we've been doing COVID clinics on the weekends, on Saturday in Comac and Sunday in Bayshore, in the morning and in the afternoon, and in the morning. And the process is pretty simple. Well, we were basically giving the vaccine to anybody, parents, families, friends of RBK. We gave it to 18-year-olds and up, gave it to 12-year-olds when it was time, 5 to 11-year-olds when it was time. We gave boosters to the qualified people every Saturday and Sunday. If you want to make an appointment in the future for your booster or your vaccine, just visit our website, rbkpediatrics.com. There's a little circle that says schedule appointment, and click Saturday or Sunday in Bayshore. It's a red button. I am very sad to say that we did get attacked by the anti-vax population on our social media page when we first opened the COVID clinics for the younger children. I was very disturbed by a lot of the comments that were put on Facebook. But you know what? We all got over it pretty quickly. So we carried on as we usually do. We don't let these little things take us down. So, I'm happy to say that we are getting people vaccinated. They need to be vaccinated in an efficient way. And people are pretty happy with us. I'm happy to say that most people are happy, and that kind of dilutes the anti-vax sentiment that, people give us on Facebook. What else made RBK Pediatrics a little different than anybody else? Well, the first thing is our laboratory, where we do the complete blood testing, the obvious COVID test and flu test and strep test and mono, throat cultures, urine cultures, and our telemedicine services, where we used it for laboratory test reviews, simple medical conditions, and we're able to connect with your child while you're on vacation, if God forbid something happens, or if your child's away and we have to refill their controlled substance ADHD medication. A project that I really liked was the laboratory test reviews, because in the past we would order a lot of lab tests, and we just go back and forth with leaving messages. Patients call the doctor always on the most inconvenient time. We would leave messages. We could never really connect to go over properly what the results of the test. And many children have problems with elevated cholesterol. Almost everybody has a low vitamin D. There's always something that we need to discuss. So with telemedicine, we're able to connect with the patient. The physician has a scheduled slot in his schedule today to go over the results, to look at the results, to tell you what you need to do, and to answer any of your test questions. So that's really good. And another thing I want to mention is our chronic care program, where Dr. Riley and Dr. Nick and Bill Sierra, they do pediatric, weight management, where they try to help, children lose weight. Our asthma care program, our international adoption program, our ADHD evaluation and management services. This is our chronic care program. Now, RBK is basically, I think RBK has been a practice transformation project from when I started at RBK in 1996. When we started, if people recall, we had the paper charts with the wall full of papers and your medical record number. And, through this COVID, whatever doesn't destroy you will always make you stronger. And indeed, it did. You hear of all these organizations that went out of business, closed, sold out to hospitals because they couldn't deal with the management of the practice and the finances. Well, RBK survived. And we're going to survive and move forward into the next 50 years. As you know, we moved our 646 Comac clinical location to the beautiful 500 Comac Road location, which is inside the St. Catherine, St. Charles part of the old Forest Lab building. We built out a 4,000 square foot complex over there. It's beautiful, it's modern, and parking is great. We all know that the parking at the Comac Road 646 was terrible on the hill. There's no more hill, plenty of parking. Another thing that we did was we had the Dr. Raymond practice at 375, which was very close to the Saxon building. we moved that and assimilated it into the Saxon building. They were building that out, but because of all the COVID delays, we had to basically squeeze those patients inside the building that was basically designed for 3 people, 3 physicians. So while the Montessori space was being built out, we used those tents as extra exam space. And now that Montessori space is the new Dr. Raymond office. And now we are in the process of renovating the old Saxon side to make it look like the Comac office. The offices will look like the new Comac office. Another piece of information that I would like to share with you is that Bayshore is a certified urgent care center, and Comac will be a certified urgent care center too. And one final piece of information is that our call center, that was relocated also into our old 646 building. So it amazes me how we were able to do this without shutting down operations. Like I remember when we moved on a Thursday, August 6th, we had to shut down the Comac 646 building for 4 hours, basically, to get all the stuff and the computers and bring it over to the 500 Comac Road building. We had to move the telephone server into the Comac 500 building, and we were seeing our first patients at noon. So we were down for 4 hours only. That is amazing. Granted, the building was already built out, the furniture was there, computers were already hooked up, but the infrastructure, the phone system, just bringing over the stuff that we had at the 646, it took a couple of hours to do and set up the lab and move the lab, but realistically, only 4 hours of downtime, which is unheard of. Only in private practice you can do that. Offices are all connected, so patients now can visit either Bayshore or Comac. We try to divert patients depending on how busy one office is compared to the other, or if a patient just wants to see a particular physician. If I'm working in Comac and you want to see me, by all means, come to Comac. If I'm working in Bayshore, come to Bayshore. Now, I'm very happy to report in 2022, Dr. Hafiz Raymond's office from 375 is fully integrated into the Saxon building. That office is built out, and we will be operational in the next couple of days. And when you visit us, please look at the Dr. Raymond Wall of Fame. That's a nice dedication to all the children that he had served over the, many, many decades. You remember if he had those little pictures on the walls, but we took pictures and framed them, and it's really, really nice to bring back some of that old practice. I'd like to tell you another surprise that we have for 2022, and that's the patient portal. The patient portal is a big deal. Please register for it. Talk to my staff about it, because within the patient portal, you could do online real-time scheduling. So I know we had some problems with, getting through to the office the whole time. We upgraded our servers, we doubled the amount of phone lines, but still, if there's a wave of people calling, it's going to be a little bit of a wait. So you can book your own appointments online, but you have to make an account first. And on that portal, you'll also be able to fill out the pre-visit questionnaires that we ask you to fill out about anxiety, depression, the prenatal stuff. And you can also fill out a lot of your demographics. You can use the portal to communicate with us through the office, through email. You have access to your medical records, and we are streamlining that virtual check-in, and it should get better if we decrease the amount of incoming calls. For our laboratory, we're going to be implementing very soon the respiratory viral testing. We're looking to see if that's a good thing to do. I know, people come in, we say you have a virus, but people would like to know which type of virus. Is it COVID? Is it flu? Is it human metapneumovirus or whatever? The urgent care certification is coming, and we're going to have more access via telemedicine with a more organized process than what we're doing now. So this is what we have in store for 2022. Stay tuned. Like I said, practice transformation happens with technology and with culture. RBK Pediatrics has always been transforming ever since I started working, but now we've become totally paperless. We have a pediatric specific EHR with electronic prescribing, telemedicine, portal, online scheduling. We're the lead practice in a pediatric only clinically integrated network. We're connected with the Catholic Health Services with HealthX. We're level 3 patient-centered medical home, and we're the clinical rotation for pediatrics for the NICOM medical students, the third-year kids, where they rotate with the physicians for a month to get their pediatric outpatient clinical experience. And then you'll see some of these kids, because I send out a video with them where they prepare some topic, and we share that with the patients. So when they come around, I would listen to them because they're pretty good. Now, I always called the RBK, the old RBK practice as the RBK Titanic. It was great. It was sophisticated. It was modern. And it was huge and clunky and very difficult to maneuver. It did what it was supposed to do. But when something comes in its way, it's very, very difficult to turn. And, with this digital practice transformation, we managed to avert hitting an iceberg and getting destroyed like many practices did with COVID. And we basically, with digital transformation and culture change in the office, where we put the patient at the center of care, at the center of everything, we're calling it the RBK Enterprise. I'm a big fan of Star Trek. And we look forward to the next generation of RBK doctors. I'm looking to lead them and staff and patients for the next 50 years. 58 years with the Titanic, and now another 50 plus years with the Enterprise. Now here is a nice footage picture of people leaving posters on the street, and we have our RBK Pediatrics COVID-19 heroes, where you can see it in all our office locations. So we're looking forward to a better year in 2022. Thank you, and see you in the office.